Hey guys, I'm Allison Cutting. I'm a junior from Wasatch High School.
I'm Michelle Cutting, and I'm a freshman at Wasatch High School.
So with all the COVID-19 craziness going on in the world, we thought we'd share a bit of perspective. So today we're going to be doing a mini workshop on the effectiveness of social distancing.
To demonstrate, Allison and I put together a little simulation. Now, mind you, this is a very, very crude simulation. There are so many variables in the growth and spread of the virus that there's no way for us to model the COVID-19 virus specifically. So it's important to point out that even if there were statistics to describe all the aspects of the virus, they would not be accurate because of the impossibility of the task of testing every individual on the planet. So we whipped up our own virus.
To do this simulation for yourself at home, you're going to need some way to represent the individuals and the communities you will be simulating. In this case, we're using Othello chips, which are super good because they've got two sides. They've got white and black, so you can distinguish between who has the virus and who does not have the virus. We're also going to need a few colors of markers to distinguish between people who have recovered and people who have died from the virus, as well as mark when people contracted the virus.
Okay, and then you're going to need an exposure radius. We're using this strange paper plate reinforcer, but you can literally use any circular object that you can find around your house, namely like a paper plate. You should be able to line up the center of the object with the individuals, and then you're going to need two different types of dice. In our case, we're using a 12-sided die, and then this is the 6-sided dice of death.
You'll probably want to record how many new cases there are each day, how many total cases there are, and as well as the deaths and the recovered people.
Here's how the simulation goes. First, we'll set up the simulated community. We scattered the Othello pieces on the floor and arranged them randomly.
Each Othello piece represents one individual. All the Othello pieces start black side up. When an individual is infected with the virus, the piece is flipped over and labeled with the day that they contracted the virus. If an individual recovers, a green border is drawn. If they die, a red one.
The infected individual is at the center of the exposure radii. Any chips in this area have been exposed to the virus. In the case of COVID-19, this would be like prolonged exposure within 6 feet of someone who is infected.
We've factored in death and recovery rates too. We've set the period of the disease to 4 days. That means that infected individuals can transmit the virus to other people for 4 days. After that, patients either recover or not. Obviously, this is abbreviated just for the sake of the simulation. Each day we'll roll the 6-sided die for patients who are on their 5th day of having the disease. Roll anything but a 1 and the patient has recovered. Once a patient has recovered, they cannot get the virus again. You can see just how quickly the virus spreads. By the end of 28 days, 10 people died and 83% of the population had contracted the virus at some point. Because of the lack of social distancing, each individual might have 2 or 3 other individuals in their exposure radii, which is a recipe for the usual exponential spread of viruses.
The social distancing simulation was drastically different from the previous demonstration. The demonstration ended earlier by a week, and only one individual died. So, social distancing reduced the death count by 90%. Because of social distancing, only 21% compared to the first simulation's 83% of the total population had contracted the virus. Think of how many lives you can save by practicing social distancing. You can see why the CDC and the World Health Organization are encouraging it so strongly. Quarantine is so tedious and boring, and it's hard sometimes to understand why we were doing it if nobody around us is getting sick. At times like these, it's difficult to see the silver lining, but hey, maybe we'll stop shaking hands and start coming up with secret elbow shakes?
Instead of spending your coronacation binging Netflix, try running your own simulation. Mess around with different variables like infection probabilities, exposure radii sizes, and population. Maybe your virus will affect different age groups differently. Maybe it will take longer to recover from. Who knows? Hopefully the simulation will help you to understand just how important it is to keep your distance. And maybe, just maybe, some new perspective might help you to hate quarantine a little less. Thanks for watching. Stay healthy.